Hello. Greetings from Rio de Janeiro, Brazil. We are at the world's largest AIDS conference, the 26th International AIDS Conference, or AIDS 2026. CNS is an official media partner of this conference. This AMR dialogue session is on the theme of infection prevention, right diagnosis, and right treatment with adherence matters beyond HIV and TB, protecting against antimicrobial resistance, or AMR as we call it. If you are wondering why is Global AMR Media Alliance, or GAMA, organizing a session on antimicrobial resistance at an HIV conference, you are about to learn why, and you are in the right space. Let us together hear our panelists and have a conversation to understand the deep relevance collectively. Our gratitude to Gujarat AIDS Awareness and Prevention Unit, or GAP, for sharing their Global Village Networking Zone session space with Global AMR Media Alliance, or GAMA. We also thank React Asia Pacific for partnering with us to host this session. Firstly, I would like to compliment the fierce struggle, commitment, inspiring leadership, and game-changing advocacy of HIV communities. When we achieve 95, 95, 95, then we achieve undetectable equals untransmittable, or U equals U. When we ensure that the HIV virus is not resistant to drugs and the life-saving medicines are working, the person stays healthy with zero risk of any further HIV transmission. When it comes to protecting people and saving lives from drug-resistant tuberculosis, we can do so much better. There is no excuse why year after year, we get around 400,000 people with drug-resistant TB. We are failing in infection prevention and control, because of which people get infected with drug-resistant TB bacteria. And we are also failing to stop misuse and overuse of medicines, because of which TB bacteria develops drug resistance. Same goes for sexually transmitted infections, urinary tract infections, and other several infections that are becoming drug resistant, which means they are becoming difficult to treat. We can definitely do better. Despite promises made by all our governments for health and gender equality, we are not on track on SDG 3 and SDG 5. Less than 54 months are left to keep these 2030 promises, but the sense of urgency and purpose is seldom seen when it comes to human right to health and gender equality, both of which are fundamental human rights and are linked inextricably. We cannot dislocate right to health from gender equality. Antimicrobial resistance, or AMR, is caused by misuse and overuse of medicines in human health sector, animal health and livestock sector, food and agriculture, and it is also polluting our environment. We cannot afford any misuse and overuse of medicines in any sector if we are to deliver on SDG 3. Governments must address AMR with a One Health approach. We also need to address gender inequalities and injustices if we are to prevent AMR where no one is left behind. A complex mix of biological, social, cultural, and economic factors arising from gender-based inequalities and injustices impact infection prevention and control. For example, the lived experiences of girls and women and gender diverse communities show how violence had put them at risk of how violence had put them at, sorry, how violence had put them at risk of getting infected or got them infected with sexually transmitted infections, HIV, or caused unplanned pregnancies. Gender inequalities, harmful gender norms, stereotypes, and tropes have normalized the neglect of health and well-being of girls and women, making them more vulnerable to AMR. It is no surprise that girls and women and gender diverse communities often slip to the last priority when it comes to disease screening or diagnostics, treatment, care, and support. This is when girls and women are themselves primary caregivers. Gender-based violence is a gross human rights violation, but progress is abysmally low in reducing it. In the last 26 years, annual decline in gender-based violence is a mere 0.2%. How can this be acceptable when gender-based violence should have become history by now? Ending all forms of violence against women and girls and gender diverse peoples, ending gender inequalities and injustices, ending ageism, and are not only human rights imperative, but also enablers to improve health responses like those of AMR. AMR and other health responses must have a feminist response, which warrants a development justice model based on care and solidarity for each other, leaving no one behind in the truest sense. Here, I would also like to share the theme for World AMR Awareness Week, or WAW 2026, which is globally observed every year during November 18 to November 24. This year's WAW's theme is One Health and Action, Prevent AMR Now. You will see the quadripartite joint secretariat on AMR's website on the screen with the WAW 2026 theme announcement and other details. Please take a screenshot and you can refer to it in your organizing this year's WAW during November 18 to 24. Friends, we apologize as Dr. Kefas Samson of the WHO is not able to join us today. We will begin by listening to a recording of Dr. Jean-Pierre Nyatsi, Director of the Quadripartite Joint Secretariat on AMR, from our November 2025 archives. Dr. Nyatsi addressed the 5th Global Media Forum ahead of World AMR Awareness Week 2025. Let us listen to his video. Dated November 2025.
That with some reality, because most of the time AMR doesn't sound as a real issue to many of us. So bacterial AMR already kills over 1 million people every year. To put that in the context, that's 2 lives lost every minute. Again, another context, in the next 90 minutes of this call, more than 180 people will die because of drug-resistant infections. It's a big number, and we have been losing this many people since I would say 1990. Every year losing these many people. And again, it's also not just the humans. AMR threatens animal health, plants, food systems, economies, and the environment. Let's remember that AMR is fueled by overuse of antimicrobials, poor infection control, gaps in water and sanitation, security, and unsafe waste disposal. Since 2016, countries have worked hard. Over 90% of countries now have national multisectoral action plans. But here's the challenge. Only 22% are fully implementing the national action plans with monitoring and financing in place. So that's why world leaders stepped up last year in 2024 with another bold commitment. The UN Political Declaration on AMR that I hope you all have seen of 2024, it has been adopted in the anger of last year in 2024. They made some commitments, and those include 60% of countries must have fully funded and implement AMR plans, 6%. For us to reach that, the member states also committed to mobilize at least $100 million, including through the AMR Multi-Partner Trust Fund that we'll discuss in the end, and other mechanisms. This is a powerful signal that the world understands the urgency and shared responsibility. However, technical solutions alone won't win this fight. We need a shared responsibility, and that's where you come in.
Now invite Albertina Nyatsi, MDR-TB survivor. I now invite Albertina Nyatsi, MDR-TB survivor and leader of Positive Women Together in Action from Eswatini.
Hello, everyone. My name is Albertina Nyatsi. I'm from Eswatini. I work for an organization for women living with HIV and TB survivors called Positive Women Together in Action. As mentioned, the topic is about antimicrobial resistance. In Eswatini is one of the countries where we have the highest prevalence of HIV and also of TB. So the issue of antimicrobial resistance is an issue that we are battling with every day. Firstly, let me start by what I think are the causes. The causes of this are that, firstly, with TB, it is because TB is a disease that we all know that we get from the air. So sometimes one is contracts TB that is already drug resistant. So then when they are given medication, you find that the medication doesn't work well. Also, there are issues with issues of infection prevention and control. We find that some people get a TB from the hospitals or from any other settings, then you find out that TB is also already a drug-resistant TB. And then also, when they take medication, you find that medication doesn't work. But also, because of certain problems that they face, that will face as TB survivors, you find that some people are not able to go to hospital to get their medication because of social issues, like the hospital is too far, there's no food. So you find that the person will not be able to drink their medication, and then issues of stock out. Our country sometimes have a stock out of medication, and then people are not able to drink their medication, as find that they become drug resistant. Also with HIV, you find that the services, so sometimes they ask HIV medication stock out. Sometimes it's like the services, sometimes they're too expensive. Some people cannot afford, because beside HIV, we develop other diseases that need medication. When you find that you are given your medication and your antibiotics, but when you go to the pharmacy, you find that the medication is expensive. Some people will then not take the medication, and it resulted to asking around for medication where they are going to be given medication that is not enough to cure the disease. Hence, they develop resistance. Okay, the other one is misuse of medication, where you find that people misuse medication. Some, like I said, they borrow. Some, they take the medication when they feel like they're better. They stop drinking the medication. So all of these are the things that cause problems. And then also, okay, there are also, when we talk about these issues, they are right that right and entitlement, especially in the workplaces, because we find that most people that are drug resistant or that are not taking their medication properly, they include even people that work in informal sector. Like we all know that most TB and HIV positive people, they work in informal sectors where you find that they are busy all day. They don't have the chance to go to the hospital. And then also you find that some of them, they are women who doesn't have enough money to cater for their medical bills. So you find that they also have to ask maybe for permission or for money. They're dependent on other people for funds to go to hospital and get medication. So once if they're told there is no money, they are not going to get the money to go to the hospital. And then also, I would like to say some of the entitlements they include that with the people living with HIV, most of them, they're not working. They do the informal work, like work in the markets. They can't afford to buy medication. They can't afford to go to hospital each and every day. Some of them, they miss doses because they can't afford to go to hospital. Hence, the need for support for them to be able to go to hospital and take their medication. There is also an issue with the stigma and discrimination. So when you find that people are discriminated, when people are discriminated, they are not able to go and get their medication. So they will be scared of being stigmatized, and then they miss their doses. There are policies that should be in place to ensure that they support and ensure that people adhere to their medication. I would say for people living with HIV, we still want to ensure that the workplace policies are still in place, but they should be reviewed because some to ensure that they are non-discriminatory, and then they also ensure confidentiality. And also, another policy that has to be there is the confidentiality policy, because some people, they don't go to hospital because they fear that their confidentiality will be disclosed. So they will miss doses because of fear of disclosure. And then some people living with HIV, they don't have even food at home. So we would like to also have policies that ensure that people living with HIV and those that have TB, they are given food so that they can be able to drink their medication and adhere to their medication. The issue of women living with HIV and TB is also another issue that makes people not to adhere to medication. Hence, we would like to ensure that there should be policies that look at issues of GBV and also issues of risk, such as climate change, because sometimes with GBV and climate change, sometimes they make people to be displaced. Because when the person has been beaten and they're running away from home, they leave their medication at home. And then also when there is issue of climate change, like there's a cyclone, people are displaced and then their medication is gone. So there is need to ensure that our policies ensure that they cater for issues of risk and also ensure that issues of gender-based violence are there in policies. I would like to say, with the right diagnosis, the right treatment, and the dignity of people, we are going to be able to conquer and ensure that there is no there is no drug resistance. Thank you.
Thank you very much, Albertina. We are really missing you here. But my brother from Eswatini, Talkmore, is here at AIDS 2026. Talkmore, Taurai, Mazorodze, TB people, Eswatini, and also part of Positive Women Together in Action, Eswatini. Welcome, Talkmore, and over to you.
Oh, thank you so much for having me here. It's an honor to be here. I was looking forward to this discussion that we are having today. My name is Talkmore Mazorodze from Eswatini. I'm from TB People Eswatini, which is a chapter of the global network of people affected by TB. I'm also working with Positive Women Together in Action as the project coordinator. So the messages that I bring today is about early diagnosis, the importance of early diagnosis, the importance of testing, the importance of treatment, and the importance of the period that one takes when he takes treatment. So we all know that all these components of early diagnosis, correct treatment, correct testing, they save lives, right? So this should not be for TB, for HIV alone, but this goes beyond HIV and TB, and it's for all infectious diseases. So as communities, I think as community leaders, I might say, I think we should play a very important role. May I also highlight one aspect that someone said during this conference. He said that what we have discovered is that we have left the issue of treatment and prevention literacy, and HIV TB spaces because we thought maybe we have done a lot. While there is a lot that we should do, we should go back to the basics and also talk about issues of seeking early testing, early diagnosis, and treatment. And I want to say to everyone today, let's all join hands as communities, as community leaders, as people affected by TB, as people living with HIV. We should go back to the basics and continue doing the work that we're doing about treatment literacy, treatment prevention. And we all know that this is important, right? We all know that this is important to get the right diagnosis, to get the right treatment. So we should tell our people that they should seek early treatment, they should seek early testing because it will save their lives. Right? For HIV, if you wait for long, the virus might damage your body, just like any other infectious disease. And for TB, if you wait for long, you risk infecting your family members, people you have close contact with. So by telling our people that they should seek early testing, we save more lives, we save our country's resources and others. The problem is not only about delaying in accessing medication. That's not the only problem that is there. The huge problem that we face in our communities is delaying seeking the treatment and prevention services. So as community leaders, we should change the mindset. We are the people who go on the ground. We are the people that engage our communities, and the communities knows us. The communities knows us from different spaces, from funerals, from churches, from other celebrations. So if we take those spaces and make it spaces and platforms for creating awareness on treatment, creating awareness on prevention of any other infectious diseases. And so when we talk about antimicrobial resistance, I think most of our communities, they don't understand. And it's time that as communities, we should include this in our community outreach programs, awareness on antimicrobial resistance. Because, for example, you find someone maybe suffering from a flu, you decide to say, I will go and buy an over-the-counter antibiotics. And then after that, that person won't take those antibiotics the right way. And find out that sometimes you take it for 1 or 2 days. When they feel better, they abandon the course. So I think as community leaders, as people who are working in the communities and advocates, we should play our role in our creating awareness on antimicrobial resistance, and also advocate for the response to antimicrobial resistance as a country, have the guidelines in our health response settings in our country. I would say whether it is TB treatment, HIV, and any other infectious disease, it is very important for one to finish their course of treatment. It is very, very important so that we don't create those challenges, don't create those complications that comes with misuse of treatment. I think for now I can stop there.
Thank you, Talkmore. Thank you very much. And for pointing out sometimes, if you have a viral infection, we go for over-the-counter antibiotics. Now, those antibiotics, they are not going to cure that viral infection, and they can gradually result in resistance, drug resistance to that. Thank you. Now, last but not the least, we have with us today Pankaj Patel, Project Director, Gujarat AIDS Awareness and Prevention, that is GAP Unit from ISRCDE. Over to you, Pankaj.
Myself, Pankaj Patel, and I am working with the Gujarat AIDS Awareness and Prevention Unit. for the 25 years. Now we are talking about the BCT at the workplace. We are running a program which we do HIV testing at the workplace itself, which we have been given the name of BCT at the workplace. The first point is early diagnosis, which is the very important. With early diagnosis, we will be able to achieve almost the goal of 95, 95, 95. Other issue is that after HIV infection, adherence to ARV therapy is crucial. If ART is stopping too often, resistance to the therapy develop, and then restart the therapy doesn't work. So adherence to ART is very important to the issue. If the VCT workplace project, we are trying to ensure that everyone diagnosed with HIV through counseling from the very beginning. Following at therapy will throughout their lives. We try to understand that reason behind stopping medicine. I am happy to respect that we have achieved 96% adherence of the 141 labors in the AMR VCT at the VCT program in last 2 years. So very proud we are, our team and we are proud, and thanks to ILO for giving me opportunity. Thank you very much.
Thank you, Pankaj. And in the case of HIV, U equal to U actually shows that the medicines are working. They are not, their virus has not become resistant to them, and that is how we have to address AMR. With this, we come to the close of today's session. My sincere thanks to our on-site as well as online speakers for being with us today. Thank you.